Hello again. All right, so we like to talk about medical considerations whenever we talk about anatomy and physiology because that's really the stuff you guys want to know. What does all this mean to me and to my health or my health of my father, my mother, my brother, my sister, my children? So some male medical considerations we want to talk about just kind of briefly are some, first of all, the cancers. And so there's a lot of um, media, a lot of fundraisers, a lot of press about female cancers like breast cancer, cervical cancer, even uterine and ovarian cancer. But sometimes the males, you may not see as much out there. And so two of the prevalent cancers when you talk about male reproductive system cancers are testicular cancer and prostate cancer. Now, I'm not saying you've not heard of these, but a lot of times maybe they don't get quite the press. You may not see a bunch of 5Ks out there for these two. So I want to make sure that you know that they do get their due. They are important cancers, and you need to know about them. So testicular cancer is actually rare, but it's the most common cancer that men get in their young ages, from 15 to 35. So it's kind of a surprise a lot of times. A young, healthy 18-year-old male, you don't expect them to have cancer, and if they get cancer, it's most commonly going to be testicular cancer. There's several risk factors. One is called cryptorchidism, and so if you think back to a previously in a lecture, I said that the male testis they hang outside the body, but they're developed inside the abdominal pelvic cavity. And in some cases, those testes don't descend. So you may have heard the word undescended testicle. And so cryptorchidism. So crypt means in like a crypt where you put a dead body. And orchid, that we use the word orchid when we're talking about the genitals. I mean, that's a term that you'll see a lot of times. So crypt orchid is genitals in a crypt, so they haven't descended. And so testicular cancer, the thing about it is sometimes it's kind of painless. All right, so it's not like you're like have a lot of pain, but you may feel a solid mass, and so that's usually kind of the first sign. And so we preach to women, do breast exams, breast exams, breast exams. Well, men also need to be doing these testicular exams. They need to palpate the area, feel the area, and recognize if there's something abnormal, a mass has been formed. A lot of times it's just going to be in one side and not both. And it's got a really good cure rate if it's caught early. So 90% cure rate if they do surgery, sometimes radiation and chemotherapy. Lance Armstrong is kind of someone that you may have heard of that had testicular cancer. But again, it can be fatal if it goes untreated. A lot of times it will metastasize to the brain. The other cancer is prostate cancer, and it's the second most common cause of cancer deaths in males. All right, so in adult males, usually over the age of 50, but not always. There's definitely some disagreement about PSA tests. So in order to determine if someone has prostate cancer, you get a digital exam. And when I say digital, I don't mean like a camera or digital, like digital media. I mean digit like a finger. Okay, so it's a rectal exam where they go up through the rectum, and they can palpate and feel the prostate and feel if it's enlarged. Now it's very common and normal for male prostate to enlarge as they age, but if it starts to enlarge and it feels kind of hard and like there's some kind of a mass there, that's a sign of prostate cancer. And also elevated levels of prostate specific antigen, because that's where it's made, in the prostate. So if you start to have problems urinating with an enlarged prostate, squeezing around the urethra, PSA levels are going up, it may need a biopsy. It may be a sign of cancer. There's always pushback on when people should get PSA screens. A lot of people say it's not until your 50s and even older, that it's a waste of time before 50. In my family, my dad had prostate cancer in his early 40s, and it was caught by a PSA test. So I'm kind of on the side of get your PSA screened as soon as you can. All right, just like a breast mammogram. Earlier the better. Get your baseline. You can treat it with surgery, sometimes radiation, sometimes with castration, where they just remove even more, remove the testes as well, drugs. There's a lot of different treatments out there, a lot of different trials, and it's becoming more treatable if it's caught early. And in some cases, if someone's diagnosed with prostate cancer late in life, like post 70, they may not do anything because the thing is, the thought is, that if you're post 70, 75 years old, there's other things going on. You're more likely to be killed by a heart attack or stroke or something else than prostate cancer because it's not a real fast-growing cancer. So if it's caught early, if you're early in life, 45, 50, 60, they will treat it because you've got a long life ahead of you, and it could be the thing that kills you. In later life, something else is probably going to kill you, so they may not treat it. So don't freak out if someone you know in their 70s and 80s is diagnosed with prostate cancer and they don't treat it, because that's actually pretty common. The side effects of the treatment are worse than the cancer itself. Some other things that can happen with the prostate: prostatitis, which is an inflammation of the prostate. This can be a bacterial infection, just kind of like a urinary tract infection, but one of the prostate. You just simply give them antibiotics. You can also have what's called BPH, benign prostatic hyperplasia, and this benign prostatic hyperplasia is where this kind of a normal thing that happens as men age. The prostate starts to enlarge, and it causes the urethra to kind of be squished, and it can cause difficulty in urinating, so they may not be able to urinate well. And so now they go in and they can do some surgery, they can do some balloon compression, kind of like a Roto-Rooter, and kind of go in there and stretch the urethra back out. So lots of different ways to treat BPH. Erectile dysfunction, I know we've talked about this a little bit, talked about Viagra, and so this is a parasympathetic nerves release not enough NO, so they don't release enough nitric oxide. And several different causes. Alcohol can cause it, some drugs, some hormones, blood vessel and nervous system problems. So if high blood pressure, diabetes, anything that has effects on the vasculature can cause erectile dysfunction. Perhaps incompetent valves, so that you can't retain blood in the penis. It won't stay engorged. The veins won't close down and hold the blood in. And so there's several different drugs out there, Viagra, Cialis, and what they do is they increase the effects of nitric oxide, and so hopefully allow for increased vasodilation and engorgement and stiffening of the penis. So erectile dysfunction, also known as ED, can be treated by several different mechanisms. There's even pumps and implants and things like that. There's all kind of things out there to try to treat erectile dysfunction. Infertility, we've actually seen a decline in male fertility in the last couple of years, and so people are starting to wonder if maybe it's the environment. Lots of things out there now, environmental toxins, phthalates, pesticides, herbicides, maybe estrogens in the water. So a lot of things, increased use of antibiotics, marijuana. So possibly our own environment may be causing these effects, global warming, all that kind of thing. So we do need to be careful with our environment because we start to see effects on humans as well. Other things that can cause infertility can be some dietary lack of selenium, too much alcohol. There are some calcium channel problems that you can have, hormonal imbalances, stress, fever, even hot tubs. One thing that you'll find is sperm develop at a lower than normal body temperature. So normal body temperature is 98.6, and sperm develop at a temperature below that. And so that's one of the reasons, because the testes hang outside the body, so they're cooler, and that allows the sperm to develop. So if someone's experiencing infertility, they may tell them to not wear briefs, but to wear boxers, because the briefs will hold the testes too close to the body, they'll be too hot, and the sperm won't develop. So maybe you're a runner and you've been wearing tight compression shorts or playing football, and these compression shorts, an athletic cup, it's keeping the sperm too hot, and so you've become infertile. So you got to cool those things down. So avoid the hot tub if you're trying to get someone, if you're trying to have a pregnancy with your partner. Some other things, a vasectomy, I want to mention what that is, and that is just cutting and ligating the ductus deferens. And so remember, you've got the testes, you've got the epididymis, and then the vas deferens goes up and over and around. So this is the pathway of sperm. And so if you cut that, the sperm can't exit the body. All right, so again, you still have an ejaculation because you still have all the stuff coming from the seminal vesicles and the prostate, but you just don't have the sperm. And it's very effective, about 100%, but you've got to give it a couple of weeks. You've got to give this time to heal and make sure that the vas deferens is completely ligated. So usually they'll have you give a sperm sample or a semen sample and make sure there's no sperm in there so that you're definitely getting 100% of your birth control effects out of that. It can be reversible, so you don't need to go into a vasectomy thinking you will reverse it, but because it may not be able to be reversed, but they are getting better and better at reversing it. Okay. And then circumcision. So we're going to talk about the difference between male and female circumcision. So this is male circumcision. We'll talk about female circumcision later on. And this is the surgical removal of the foreskin. So if you think back, you've looked at your anatomy, and you see the glands of the penis kind of looks like that. Well, in an uncircumcised male, there's actually something called this foreskin, that kind of a hood that covers the end of the penis. And so it's a cultural thing. So it's not, it doesn't have to be done. So it definitely depends on where you're from and what your belief system is. In the U.S., about 60% of all males are circumcised. Okay, our newborn males are circumcised. It's about 15% other parts of the world. So what we have seen is, because you have this hood, it is an area that tends to easily become infected. So people that are uncircumcised male, we do see a higher risk of HIV infection, higher risk of STDs and other reproductive system infections because it's a little harder to keep clean. Think if you've ever had a child, if you had boys especially, just imagine this is just one more area. You've got to pull the hood back and pull the glands out and kind of clean around that. So it's kind of a sanitary issue. But again, it's really a family decision. So I'm not here to tell you yes or no on circumcision. Again, it's in the U.S. It's pretty common, but again, it's for individual determination for you and your family. All right, so that is all I'm going to talk about now, and I will see you again in another video. Thanks again.